News Today.
We have no reason to believe in our data that we've reached the peak.
Thank you for waking up with us today. I'm Maya Hudgens.
And I'm Hunter Elise. We are kicking off our special Operation Vaccination.
Throughout the day, you will hear local doctors and state governors speak on the COVID-19 vaccine and the importance of taking it.
They'll also discuss the latest surge in COVID-19 cases within the ArkLaMiss.
That's right. Lastly, we'll have a list of locations on where you can get your shot.
Starting us off this morning, NBC 10's Bodie Brooks spoke with the governors of both Arkansas and Louisiana and the director of the National Institutes of Health about the state of the pandemic.
Here's a look at that conversation.
Hospitalizations in the Monroe area, what we call Region 8 of our state, up 700% over the last month for COVID patients.
Well, El Dorado is low in terms of the vaccination rate as compared to the rest of the state and the nation. And that's not a criticism, but you know, it's a matter that we've got to do more in order to encourage vaccinations, to educate people on the importance of it.
Talking to all of you right now in Louisiana and Arkansas, you are kind of ground zero right now for the way in which this latest variant is really causing a serious lot of trouble.
As you just heard, the National Institute of Health says that the latest variant is causing a lot of trouble in the ArkLaMiss. Here's Dr. Wude from South Arkansas talking about the many ways that the coronavirus affects the body.
When the coronavirus infects a patient, the first thing I see as a physician is fear. Fear is that unpleasant emotion that people feel, especially when they know that there is a possibility of death. The coronavirus can infect patients and cause damage from head to toe. When their symptoms are severe enough to be hospitalized, we see that these patients get confused. Some of them start getting agitated, pulling out their IV lines, pulling out their oxygen masks, their oxygen tubings. When they come back to their senses, some of them don't even realize that they did that. Coronavirus can infect your lungs. The most severe symptoms we see in coronavirus is patients who have pneumonia or infection of the lungs from this virus. When the lungs are infected, these patients don't have enough lung capacity to do a good air exchange. That's when you see them needing supplemental oxygen. That's where you see those pictures of those patients on TVs or magazines with the oxygen tubings, the ones with the bigger mask. Or, unfortunately, when it gets so severe that the infection, the virus pretty much covers and infects their entire lungs, they have what we'll call ARDS, or acute respiratory distress syndrome. Some of them end up on the ventilator machine or the life support machine. Most of these patients are not able to keep up a good enough blood pressure to pump blood to all the vital organs. As some of these patients start producing blood clots to their lungs that can cause what we call pulmonary embolism, making it difficult for them to breathe. Blood clots to their heart causing a heart attack. Blood clots to their brain causing a brain attack, or what we call a stroke commonly. The coronavirus, actually, the long-term effect for people that survive it, we call them the long haulers. You see these people with sustained symptoms of fatigue, insomnia, unable to sleep at night. Some of them have neuropathy. But unfortunately, when the coronavirus becomes so severe, these patients can die from the severe infection of the lungs, from the severe infection of the kidneys. Some of them die from a heart attack. Some of them die from a stroke. This is an emerging infectious disease. And like most emerging infectious diseases before it, the one way we can keep it under control is by getting vaccinated. So I encourage everyone from the ages of 12 years old and above to please get vaccinated so we can keep this virus under control.
have been working since the start of the pandemic and are now asking for the public to get vaccinated to help put an end to COVID-19.
Here at St. Francis Medical Center, we've cared for over 5,000 inpatients and patients through our emergency room since the pandemic started. At present, we're seeing this fourth surge and seeing the largest number of patients referred to our center that we've seen during the entire pandemic. Community members and patients have suffered great difficulties and sorrow going through this pandemic with a great deal of loss of life. I would encourage people to get the vaccine in order to avoid hospitalization, avoid critical illness, and avoid death. And I genuinely believe that over the next 2 to 3 months, the choice comes down to either get vaccinated or you're going to contract Delta.
Still to come on NBC 10 News today, we continue our Operation Vaccination Special.
That's right. We will have a look at vaccine locations on where you can get your shot. But first, here's Lexi with a look at your Fish and Game forecast.
Those temperatures